Throughout this episode, you will see actual footage from inside the Trenton Psychiatric Hospital, filmed almost a century after the events recounted in this episode. Special thanks to Abandoned New Jersey for providing this footage. It was the year 1916 in New Jersey, and one physician had the courage to claim that he had discovered a universal treatment that was effective for all mental illnesses. Henry Cotton was the alienist at the Trenton Psychiatric Hospital, also affectionately known as the New Jersey State Lunatic Asylum. And if things had gone as planned, you would recognize this man's name as a superstar genius. Instead, this man's name is buried deeper with every passing year. Today, we examine one of the times that psychiatry lost its damn mind. This is the story of focal sepsis, Dr. Cotton's insanity cure. Allow me to explain. Trenton admissions ward was beautiful, so alluring that many patients paid for the privilege of being taken care of there by Dr. Cotton and his worldly renowned staff of medical professionals, many of whom appeared as kindly nurses dressed all in white. White as well were the walls, the sheets, the bed frames, and the windows were bright and large enough that you almost forgot that they were specifically designed to keep people deemed mad inside. Back then, that word mad could refer to mental illnesses, physical ailments, and criminal offenses in combination. But most of all, to be mad was to be hopeless. Most psychiatrists at the time held the pessimistic view that few people deemed mad would ever recover permanently. But Henry Cotton had a very different philosophy. He believed that mental disorders were symptoms of hidden underlying diseases, and not diseases themselves. And if the underlying problem could be found and cured, the mental disorder would correct itself naturally. People badly wanted to believe this alternative opinion, and that's why newly admitted patients were given a full workup, including examinations of the ears, eyes, nose and throat, teeth, and internal body, sometimes using a shockingly large amount of x-rays. What was it exactly that the doctors were looking for? They were looking for something called focal infections, the basis for Dr. Cotton's focal sepsis theory, which he embraced fully in 1916. According to the theory, hidden pockets of bacteria in one place in a person's body, like the teeth, could cause problems in another part of that person's body, like the brain. So, removing a person's infected teeth, for example, could therefore cure a person's insanity. Cotton's theory was constructed piecemeal from other young theories. Research at the time had recently revealed that paresis, a mysterious mental disease, was actually just the final stages of syphilis, which had a traceable physical root cause, and the young science of bacteriology had shown lockjaw, or tetanus, began in a wound before the toxin spread throughout the body. Other theories around the time included one Dr. Billings claiming infected teeth and tonsils could lead to arthritis, one Dr. Bouchard's auto-intoxication theory that constipation led to disease, which inspired Dr. Lane's intestinal stasis theory, or Lane's disease, that constipation should be treated by surgical intervention, and one Dr. Hunter's theories of oral sepsis due to conservative dentistry. In other words, gold cap stomatitis, where having dental work done instead of having your teeth pulled led to diseases. What made Dr. Cotton different was that he physically implemented these theories. He took these cutting-edge ideas from medicine and applied them to psychiatry with a cutting edge, because despite his reputation as a healing artist, once the patients made it past that beautiful admissions ward, things got physical, fast. He began with the teeth, because they're closest to the brain. Duh. He claimed that any dental work performed on a tooth, bridges, caps, fillings, was enough of a reason for it to be removed because it could be hiding a pocket of infection. In the early years at the Trenton Psychiatric Hospital, the average new admission had 10 teeth pulled, and later on Dr. Cotton referred to those early cases as handled too conservatively. Later, he advocated the removal of all teeth. In fact, Dr. Cotton convinced his wife to have both of their sons' teeth removed completely, and later on, hers as well. He soon incorporated the standard removal of the tonsils. If you don't know what the tonsils are, I suggest you find out. Dr. Cotton knew what they were, a menace to society. No, seriously, he was a major proponent of having young children's teeth and/or tonsils removed to correct their bad behavior because he thought that bacteria was poisoning their brains. He wanted to set up screening procedures for children so that he could find and yank naughty tonsils and then prevent a generation of mental disorders. This theory may have contributed to the overprescription of tonsillectomies in children from about the 1920s to the 1960s. Many of the children who received tonsillectomies during this time received no benefits from the procedure whatsoever. After teeth and tonsil removal, Dr. Cotton described marvelous results for some of his patients and expressed utmost confusion that other patients had no results whatsoever. He decided that clearly he wasn't taking things far enough. Maybe, he reasoned, the bacteria had been swallowed, and so he moved on to various exploratory abdominal surgeries. These new procedures included one where the stomach was removed, but by far the most common new procedures were the colon resections and the colectomies, which involved taking anywhere from inches to feet of intestines out of the body. Dr. Cotton justified these various surgeries by pointing to the fact that bacteria were present. In his 1922 paper, he expresses concern towards the sheer multitude and variety he was finding in the intestines, liberally categorizing them as dangerous. Quote, "Any of these organisms may become so virulent at any time that they cause the death of the patient. Of course, as we now know, gut bacteria are perfectly normal features of the human body." Strangely, Cotton did very little to conceal the numbers of deaths associated with his abdominal operations, and stranger still, few people who learned of the numbers objected to them. In one public report and presentation from 1922, Dr. Cotton reported that of a group of 250 colon operations, 30% had died, 30% were unimproved, 15% were improved, and 25% had recovered. And these were the fudged numbers he used to paint his casework in a positive light. Later investigations would put the death rate even higher, and the recovery rate much lower. A lot closer to zero, actually. He removed and added other things too, like reproductive organs and unnecessary vaccines. Anything and everything was a valid treatment until he either saw improvement or the patient died. And if the patient never showed improvement and yet still stubbornly clung to life, Dr. Cotton explained this away by saying that the surgical interventions were too late and the bacteria had permanently poisoned the brain. Conveniently, this helped explain why the patients who were the worst off, those who had the most severe mental diagnoses, were the least likely to be helped by the treatments. Meanwhile, other patients would be convinced by the placebo effect, pretend to get better in order to avoid more surgery and get their freedom, appear to get better due to the quieting effects of surgery, like anesthesia and being confined to bed afterwards, or coincidental temporary improvement, like what sometimes happens naturally in bipolar disorders. In other words, nothing Cotton did worked long term, but he convinced himself and his followers otherwise. Dr. Cotton regularly boasted, very incorrectly, that the recovery rate using his methods was 85%, and that the state of New Jersey was saving boatloads of cash by 1. Bringing in private patients, cha-ching, and 2. Discontinuing the care of those released or killed. To his credit, it does take a lot less money to care for dead people. Eventually, other doctors began to get annoyed with him. Not because of how he was treating his patients, no, but because he liked to put his findings in newspapers before scientific journals. Henry Cotton also liked to give flashy presentations to draw attention to himself, which was just annoying, mostly. Anyways, because of that, and not so much the maiming people thing, eventually an investigation was launched into his claims. This investigation can be best summed up from a quote from a 1923 paper by Koploff and Kirby. "There is no relation of cause and effect between specific bacterial toxins coming from focal infection and the functional psychoses. Cotton's interpretations are at variance with his facts. You would be forgiven for thinking that this was the end for focal sepsis. But here's the thing. Dr. Cotton didn't even go to the 1923 conference at which his findings were the main topic of conversation because he was too busy sailing across the ocean to spread his findings to Europe. Had he been at the conference, he probably would have started a squabble due to his belligerent personality and destroyed his reputation. Instead, the physicians in attendance mostly just shrugged and said, "It's his hospital, let him do what he wants." And this is why we should remove all federal regulations. In 1924, finally, a formal investigation was commissioned. But, to make sure it was an agreeable one, the person conducting it was appointed by Cotton's former advisor from Johns Hopkins, one Dr. Adolph Meyer. They were close, in cahoots even. Cotton kept in almost obsessively regular contact with Dr. Meyer by mail, and even named one of his sons Adolf in his honor. Meyer secretly suspected that operations at the hospital were going poorly, and had even previously expressed his dissent towards the focal sepsis theory, telling Cotton that he was oversimplifying mental illness with a monocausal explanation. Cotton didn't exactly listen. That's why Meyer appointed another of his underlings to be the investigator. Her name was Phyllis Greenacre, a ridiculously hard-working individual, and, truer to her scientific nature than to her comrades within science, Greenacre actually did the work she had been assigned to do, instead of covering up the poor results. Importantly, the delusional Dr. Cotton seemed to actually believe that his work was helping people, and so he let Dr. Greenacre do her research, although he wasn't exactly nice about it. Cotton had Greenacre stay in a converted broom closet that just so happened to be in the building that housed the criminally insane, meaning that while she did her work, she was within earshot of gibbering murderers. Greenacre shared her memories of Trenton with Dr. Andrew Scull, who published those thoughts in his book, Madhouse, A Tragic Tale of Megalomania and Modern Medicine, which I highly recommend. He gave me permission to read directly from the words of Greenacre's experience, in order to give you the most direct experience of Trenton that I can. As usual, the buildings gave off that sour, fetid odor so characteristic of mental hospitals. But there was something subtly different about the patients at Trenton. She could not put her finger on it at first. Something about their faces and their conversation struck her as odd and vaguely disquieting. She slowed the rapid pace through one of the wards to observe more carefully. And then she understood. These patients were all devoid of teeth, and they had not been given dentures. That was why their speech was slurred and so difficult to comprehend, and why their sunken faces gave even the youngest among them the appearance of premature age. One of them unexpectedly grinned at the elegant young woman who had stopped to inspect him. She saw only his gums and recoiled in shock. Like the others on the ward, he seemed thin and malnourished. Small wonder, she thought, for how on earth did they manage to eat? In addition to the difficulty of working under such conditions, Dr. Greenacre had to deal with being given bad statistics and had to travel to visit the released patients herself. She found many peculiar things. Sometimes patients who were readmitted were incorrectly marked as different first-time cases. Some of the workers at the hospital turned out to be former patients, and she even found that some of the patients marked cured and released were still in the hospital, tucked away in some of the back wards. She found that a lot of what was holding the operation together were the career motives of Cotton's underlings, who knew of the various atrocities, but chose to ignore them. And then, in the middle of Greenacre's investigation, due to state politics, New Jersey itself decided to take a look at what Dr. Cotton had been up to lately. A committee, called the Bright Committee, called Cotton to court, where he faced many angry families and employees, who told horrific tales of unconsenting patients being dragged into operating theaters to have pieces of themselves hacked away. During these trials, Dr. Cotton was so pressured that he went mad himself and went away to Arkansas to recover, leaving the hospital to continue operating without him. At this point, he yanked out several of his own teeth, concerned that they were poisoning his mind. Fortunately for Dr. Cotton, smart lawyer-type people argued on his behalf that the brutish behavior of the orderlies was due to them being underpaid, and the fact that the state hospital had more surgeries than any other hospital was because it was more modern than other hospitals. It also didn't help that many of the testimonies came from ex-mental patients, because they had little credibility. Cotton walked away free. And when Adolf Meyer saw what a fragile mental state Dr. Cotton was in after the trials, he reassured him that the Greenacre report that was also currently underway would never see the light of day until Dr. Cotton signed off with his seal of approval. That's right, the one honest report suddenly had no real power anymore. Greenacre finished it anyway, after countless hours of ridiculous work over 18 months. The pattern she found was that those cases with the best eventual outcomes were those least treated by Cotton. Quote, "Thorough treatment, including abdominal operation, is not only dangerous to life, but ineffective in the cases of those who survive. There is practically no evidence of positive results obtained by detoxification methods." And you can bet that Cotton never gave his approval to publish these findings. Dr. Greenacre finished her report in 1926, which Dr. Meyer carefully buried. It was never officially published. Cotton returned to work, where he began advocating even more aggressive treatments in the tail end of the 1920s, including implementing colonic irrigations for up to 8 hours a day on patients. In 1928, he was diagnosed with a heart condition, and so he decided to have the rest of his teeth removed, after which he claimed his abnormal heartbeat had corrected itself, which was truly delusional. But then something wonderful happened in 1930. Dr. Cotton was moved to a new position at the hospital, due to concerns that he was promoting a conflict of interest by accepting both public and private patients. The man who replaced him immediately discontinued the abdominal surgeries, much to the horror of Dr. Cotton, who fought continuously to try and get them reinstated. The teeth pulling, tonsillectomies, colonic irrigations, sinus puncturing, and malarial therapy, in which people were injected with malaria vaccines in order to get them to quiet down, all continued though, even without Cotton in charge. Dr. Cotton continued to write about his theories, and even thought that he had stumbled across a crucial clue as to why the abdominal surgeries didn't always succeed. His theory was that if the surgery was done while a person still had some teeth remaining in their head, they were more likely to die than if they had all of their teeth removed first. In 1932, another investigation happened, this one also with damning conclusions about the actual results of the abdominal surgeries. Cotton ignored this investigation. He was too busy writing an article about how genetic inheritance of mental disorder was impossible, and how focal sepsis was the only explanation that mattered. This article appeared in print in June of 1933, within which Dr. Cotton is referred to as one of the leading psychiatrists of the United States. Unfortunately for Dr. Cotton, he never got the pleasure of reading that praise, because at that point he was dead. A heart attack had claimed him suddenly, but his legacy was much harder to kill. Even though abdominal surgeries had already lost favor, teeth and tonsils continued to be pulled all over the world. It took several more research initiatives, including one by Riemann and Havens in 1940, that specifically concluded that the removal of teeth and tonsils had no impact on systemic diseases. Even then, those doctors at the New Jersey State Hospital at Trenton continued yanking until 1960. Believe it or not, there are still arguments about some of Cotton's procedures today. In the dental industry, for example, there are loud arguments going on about whether mouth infections lead to increased chances of heart and brain problems. Colonic irrigation has seen a resurgence in popularity in the form of alternative medicine enemas that, if anything, only make the body less able to regulate itself. Cotton's mistake has been repeated over and over again throughout psychiatric history in the form of bloodletting, insulin and histamine shock therapies, lobotomies, hydrotherapies, vaccine therapies, certain forms of electroconvulsive therapy, overprescription of tranquilizers, and on and on. These are all things that make mental patients easier to handle, but does not treat the illness. You have to wonder to what degree Cotton thought he was actually helping people, and to what degree he knew he was just forcing patients to shut up and sit still. As someone who has previously worked in the mental care industry, I can honestly see why that might happen. Caring for people who can't care for themselves 24 hours a day is extremely difficult. These torture methods made caring for these people more bearable in exchange for throwing ethics out the window. And that's why the people who came up with these treatments had to convince everybody else that these treatments were ethical. They were not. If you enjoyed the ride, please subscribe. Liking this video has no known side effects, and I'll see you next time.